Namaste. According to WHO, by 2030, 843 million people will be suffering from lower back pain, and it's a huge number and it's an alarming situation. Also, it is estimated that between 50 to 60% people will be suffering from lower back pain, whether it is chronic or acute in some stages of their life. So this is the high time that we need to think about it and take proper precautions. In this video, today we will be speaking about lower back pain, its causes and the yogic management of lower back pain. Also, we will speak about the diet because diet plays an important role in case of lower back pain. So lower back pain is the pain in the area between the lower part of your ribcage and your hips, and lower back pain affects the lumbar part of your spine or your back, and it can be lasted for short time, that is acute, or it can last for long term, that is chronic. And lower back pain affects the quality of life badly, and it can impact the mental well-being. And due to lower back pain, the range of your spinal movement will be restricted, so it will limit your daily engagement and activities, and it can happen at any age. And there are many reasons of back pain. We will discuss them briefly. Let's talk about the sign and symptoms of lower back pain. So lower back pain can produce dull ache or sharp pain, and sometimes the pain is getting radiated to your entire body, especially the pain sometimes getting radiated down to the hips or down to the back of the legs, which is called sciatica pain. And sometimes this kind of pain will give you feelings like electric shock, numbness, then tingling sensation or weakness in the muscles experienced with leg pain. Due to lower back pain, sometimes you will feel stiffness in your lower back muscles, means you will find it very difficult if you are trying to getting up from seated position, then you will find it very difficult to keep your spine straight or stand straight due to the stiffness in the muscles. So due to the stiffness of your spine, sometimes you are not able to maintain the alignment of your torso with the spine. So in that condition, people are maintaining a forward bending, means their spine are bending forward. So this is called the kyphosis of spine. So it is very painful. So this is another problem of lower back pain. Then sometimes after strain, the muscles of your lower back can get contracted uncontrollably, which is called muscle spasm, and these are very painful and uncomfortable. Let's talk about the causes of lower back pain. In yoga, there are two causes. One is Adhija, one is Anadhija. Adhija means the causes which are born out of any form of mental stresses, and Anadhija means the causes which are born out of not only from mental stresses, but there could be some other cause. So let's talk about the Adhija or psychological or psychosomatic stresses which can contribute significantly to the lower back pain. So psychological stress can absolutely worsen your lower back pain. When you are in stress, you are in either fight mode or flight mode, and this causes muscles to tighten in the neck, shoulders and lower back, and the chronic tension leads to muscle fatigue, stiffness and pain. Under stress, our nervous systems are overloaded, which can heighten the pain sensitivity, means our brain becomes more reactive to discomfort. Even mild aches feel more intense. Then under stress, people often slouch or adopt poor postures, skip exercises or stress routines, and they can sit for long period without any work. This can also worsen back pain over time. Then the next factor is psychosomatic pain. In some cases, the emotional stress gets stored in the body and shows up as a physical symptoms. Then sleep disruption. Stress often lead to poor sleeps, which reduces the body's ability to recover from tension or strain. That's why lack of deep rest means muscles are not fully repaired, and in this way the pain increases. And these are the factors under Adhija causes which can significantly contribute to the lower back pain. Now let's talk about the Anadhija causes. Under Anadhija causes, the important factors are injuries, then infection, the degenerative changes in your spine. The key degenerative changes in the spine includes degenerative disc disease, when the intervertebral disc lose the liquid content and shrink. As a result, there is less cushioning between the bones. So as there is less cushioning, there will be more stress on the joints. So there will be pain, stiffness and irritation. Then facet joint osteoarthritis. The small joints in the back of the spine develop arthritis just like knees. So as a result, there will be inflammation, bone spurs, and there will be intense pain. Then the spinal stenosis. This is narrowing of the spinal canal due to the disc bulges, bone spurs or thickened ligaments. So as a result, there will be pressure on spinal nerves. Then there will be pain, numbness, tingling in the legs. Then spondylosis. This is a general term for age-related spinal degeneration. So it is very common in the cervical part and in the lumbar part. Then spondylolisthesis. It is basically when one vertebra slips forward over the one below it due to the weakened joints or disc collapse. So as a result, there will be back pain, leg pain, or there will be neurological problem also, as sometimes nerves are getting compressed. Another condition which can contribute significantly to the lower back pain is called ankylosing spondylitis, and this is an inflammatory disease which basically affects the spine and the sacroiliac joints, and over time it can lead to fusion of vertebra which make the spine rigid and less flexible, and which can create intense back pain. Other than these conditions, many diseases like kidney stones, then fibromyalgia, then other diseases can also create back pain. Obesity is one of the major cause of back pain. People who are obese, who are having high body mass index, they are at higher risk of back pain. So another important factor is poor core strength. If your abdominal muscles are not strong enough, then in that case they are not able to support your spine, so it will lead to intense back pain. Then the people who are smoking, who are having excess alcohol, they are at higher risk of back pain. So quit smoking and alcohol today itself. So what we can do to get rid of back pain or to manage back pain? We should be physically active. We should take care of our mental health. Then we should maintain a healthy body weight. Then quit smoking, tobacco, alcohol today itself only. Then we should have a good sleep, because if your sleep quality is good, then your body will be restored and your body will start functioning well. Let's talk about the diet, or the food items which we have to consume, or the foods which we have to avoid in case of lower back pain, so that we can manage the lower back pain in a better way. We should include the food items in our everyday diet which are having anti-inflammatory properties, like ginger, then turmeric, then olive oil, then grapes. All these foods are having anti-inflammatory properties that will definitely reduce the swelling in our joints, in our body, and thus when the swelling is reduced, obviously your pain will be reduced. And we should include a piece of ginger and a piece of turmeric in our everyday diet. In the early morning every day you can consume a piece of turmeric, and it's a very good practice if you can do this. So this will also help you to reduce the pain, because turmeric is having a chemical called curcumin, so it is acting as a painkiller. Olive oil contains good amount of oleocanthal, which is acting as a ibuprofen, so it is acting as a painkiller. So you can add olive oil in your everyday diet, in your salad, then during cooking also you can add. For bone strength and bone density, some vitamins like vitamin D, vitamin K, vitamin B12 are very important, and some minerals like magnesium, then calcium are also very important. So sunlight is the best source for vitamin D. For calcium, if you are lactose intolerant and if you are vegetarian, in that case you can consume ragi. It is a good source of calcium. So for bone strength, calcium is very much important, and vitamin D. Deficiency of magnesium can lead to lower bone density, even osteoporosis. So you can have dark chocolate to meet the criteria of magnesium. Vitamin K is very important as it binds the calcium to our bone to improve the bone strength and to prevent our bone from further injuries. So as the source of vitamin K, you can have green leafy vegetables. Fermented foods are the good sources of vitamin B12, and it is very important to maintain the bone strength and bone density. Probiotics, then fermented food like curd, idli, dosa, dhokla are good source for vitamin B12. So these are some food which are good source of vitamins and minerals, and some foods which are having anti-inflammatory properties which will reduce the swelling and pain. You can add them in your daily diet. Now there are some foods which you must avoid to manage lower back pain, and if you add them in your daily life continuously, then it can worsen your back pain, like sunflower oil, then groundnut oil, then mixed vegetable oils you must avoid. You have to avoid the fast food items, the fried items, the packaged food items, or the ready to eat food items. All processed foods, then the foods which contains high amount of trans fat, saturated fat, you must avoid. Avoid sugar, then dairy product, and most importantly, quit smoking. Avoid sugar, then dairy product, and most importantly, quit smoking, tobacco and alcohol, because the people who are smoking, consuming tobacco and alcohol, they are at higher risk of developing back pain. So today itself only quit them. So this is all about the diet you have to maintain in case of lower back pain to manage your lower back pain effectively. So in the next part we will be discussing about the yoga asanas or yogic practices for managing lower back pain.